Good morning, ma'am, sir. Today I'll be doing my demonstration of injection of medication, and this is for my checklist. I will go to my patient and ask for his name and his birthday, and I'll also make sure, double check, of course, and make sure that I explain to him and he understands or she understands very well what the procedures are and all the medications that I'll be injecting to him as per the doctor's order. So assuming I'll go and go to my patient, I'll knock first on his door. So I come in and I'll say, "Good morning, sir." I'll introduce myself. "Good morning, sir. My name is Jan Vencer Faut and I'm your student nurse for today. May I ask what your name is? And when is your birthday?" Assuming that he gave me his name and birthday, I'll then explain what the procedures are. So, sir, the procedures will be injecting first insulin because the doctor said that your blood glucose is rising. And I'll also inject tetanus toxoid um, intramuscularly, and I'll also inject antibiotics. But first I'll also test it in your skin to check for any allergies. Okay, once the patient understands what the procedures are, I'll tell him that I'll come back and get the equipment. So, sir, I will come back and gather my equipment first in the nurse's station. Assuming now that I'm in the nurse's station, um, I will gather my equipment. So first, my equipment are 3 syringes, two tuberculin. Tuberculin will be used for the subcutaneous and the skin test, and then my 3 cc syringe will be used for the muscular injection. I also have 3 spare needles. This will be used for the getting of the medicine from vial. And then we have our medicine. Assuming that this is a vial containing medicine, this will contain the cefuroxime, which is the antibiotic, the tetanus toxoid, and the insulin. And I also have the sterile water that will be mixed with the antibiotic. Okay, and I also have cotton swabs, medical tape, and clean pair of gloves. So now I will read and consult the policy regarding the aspiration of intramuscular injection. And after I've done that, then I hygienate my hands, wash my hands. So assuming that I've washed my hands, I will now track the medication from the vials. So first we have the tetanus toxoid. We'll first get the tetanus toxoid. To do this, we will remove first the needle that will be used for injection and replace it with a needle that is going to be used for getting the medication. This is to ensure sterility of the needle that will be used for injection. To do this, we'll move the needle at the cap and then retract. So the doctor had ordered 0.5 0.9 ml tetanus. This is done. I will cap it. And throw it in my paper. And put the cap back. Next is the insulin. We'll do the same thing. Okay, and then we will first clean. Since it's open, we'll clean it. Okay. Now we will get the medicine. The doctor ordered 0.3 ml of insulin. Done. Then replace the cup again for injection. Last one is the antibiotic. To do this, the doctor ordered that we will get 0.1 of the cefuroxime and 0.9 of sterile water. So the cefuroxime 0.1 ml. And 0.9 water. Assuming that I have gotten the medicine, I'll put it back, the cap, and put the one for injection. So when you have multiple medications, remember to put a label on it. So assuming that I have done it already, so these are the labels for the medication, and always double check that these are the right medications that the doctor has ordered. Okay, now once everything is prepared, I will return to the patient. Okay, now assuming that I'm on the room with the patient, I'll first knock at his door. And I'll enter and introduce myself and the procedures again that I'll do. So, sir, my name is JV and I'm back to give you your medications. But first of all, are you comfortable in your position? Do you need anything else? Do you have questions? So if none, sir, I may now proceed. And assuming that the patient is in his most comfortable position, I'll now inject the medications. First is the tetanus toxoid that will be injected intramuscularly. To locate the site, you should the shoulder blade. Okay, here. We'll place 4 fingers, and the ideal site is that there's no lesions, tenderness, hardness, and stuff like that too, and that will be our ideal site for injection. And then I'll place my thumb, and that is our injection site right here. So assuming that it is the side, the patient, this side, I will now put on my gloves. Okay, now I'm ready to inject the patient. So we'll get the 3 cc injection and check if it's the anti-tetanus. And if you double checked it already, we're now ready to inject it. Remove the cap and perform the Z-tract. You retract the skin, press it like that, and then now we're ready to inject. And then we will wait for 5 to 10 seconds. Okay, and then hold it with your non-dominant hand to stabilize it, and aspirate slowly. So if there is no blood that's coming out, we're now ready to inject the medication. Okay, once this is done, wait for 5 to 10 seconds again, and slowly remove the needle. And we're gonna put a clean cotton bud, medical tape. Okay. Now that it is done, we'll now proceed to the injection of insulin. This will be done in this site, subcutaneously. Okay, something right here, and on the other hand, of the patient, and we'll check for tenderness and hardness and softness. If there's none, then that will be the ideal site of injection. So now double check again if it's the insulin. So it's the insulin. We'll now perform the injection. Just clean the site. So to clean the site is inside going outside. Okay, now we're ready to inject. So as we inject this, it will be angled 45 degrees. Okay, so we're gonna inject it now. This one we don't have to aspirate. Wait for 5 to 10 seconds. Then I'm gonna inject it slowly. Oop. Hold it with your non-dominant hand and then release. What we're gonna do here is we will only wipe it. Okay. Now, the last we'll perform is the skin test. Skin test, the ideal site is here in the forearm. We'll also check for no lesions, no tenderness, no swelling, and no softness. Okay? Right here, we're now ready to inject the, the, the antibiotic. We'll double check first if it's the right medication. Okay, now we're ready to inject it. So we'll inject it right, like it's really parallel to the skin. Okay, so now we'll insert it. And stabilize it with your non-dominant hand and inject slowly until it forms a bleb. Okay, once it forms a bleb, wait for 5 to 10 seconds and slowly remove the needle. Okay, so once it is done, we will draw a circle in the bleb. Okay, the point of the circle is that we will check if the bleb goes out to this circle. It means there's an allergic reaction, and if none, there's he's okay. And we'll write the time. Since now is 7:30, we'll write the time 8 o'clock. Okay, once this is done, the patient is ready, and we'll now explain that we're done. So sir, the medications are now done, and we'll come back later for the skin test to see if there are any allergic reactions. And then I'll remove my gloves, leave the room, and what I'll do is document everything that has transpired, especially if the medications are effective, everything, the time, and of course if there are any allergic reactions to the patient. And everything is done. Thank you.